Good morning. My name is Mark, and welcome. My name is Mark Carrozza. I am the Director of Health Landscape with the American Academy of Family Physicians. I don't have prepared remarks. I'm going to sort of just talk to you for a minute. I want to tell you a little bit about what we've been doing recently. For us, something that's very important is physical vital signs. How many of you have ever had your blood pressure taken? Who hasn't had their blood pressure taken? Everybody's had their blood pressure taken. Okay, we do it at the doctor's office, we do it at the emergency room, we do it at the employee health clinics, we do it during well-child clinic visits. If we go to a supermarket, somewhere between the bank and the pharmacy, there's a little machine where they can take your blood pressure. Okay, we've gotten very good at it. Compare that to 300 years ago. This is the gross part of the story. 300 years ago, when we first started measuring blood pressure, they did it by taking a big 8-foot tube of glass and sticking it into a horse's neck to see how far the blood would go up inside this tube. Nobody's grossed out by this story. I expected all kinds of just horrible, horrible things. So we've gotten much better at that. Raise your hand if you think we've gotten much better at that. Okay, good. Where was I going with that? So blood pressure. So you go to the supermarket, you sit down, you take your blood pressure, it pumps up, it does the thing, it tells you your numbers. We've gotten very good at measuring blood pressure. And on that machine, there's a little card. On that little card, it says if it's between this and this, you're normal between this and this, you're pre-hypertensive between this and this, you're stage 1 hypertension. We've all seen the card. We've all sat at the machine and done that. Okay? So we're very good at measuring it. We're very good at knowing what it means. More importantly, as Jim just mentioned, we know what to do about it. We know when diet and exercise would help. We know when mindfulness meditation. We know when it's time to think about losing some weight. We know when it's time to start thinking about some medications. We know how to measure it. We know what it means, and we know what to do about it. My interest right now, in the interest of Health Landscape and the Academy, is community vital signs. You've probably seen the phrase going around. You've seen the idea of social determinants of health. For us, we like to distinguish between physical characteristics, blood pressure, age, sex, race, weight, hemoglobin A1C, all the things at the physical level, from the social determinants of health level, the person's religiosity, their income level, how many social connections they have, and we also like to compare community vital signs. What do we know about the community that they live in, the poverty level, walkability? What do we know about food deserts, pharmacy deserts? For me, we have a lot of interest in that. If we compare what we know about community vital signs today with what we know today about blood pressure, I think we have a lot of work to do. We've made a lot of progress. We know that poverty is important. We think that walkability is important. We're pretty sure that knowing if you're in a food desert is also important. But compared to what we've done over the last 300 years with blood pressure, we have a lot of work to do. So what I want you to do at some point during the day is I want you to turn to your neighbor, because I'll talk to Jennifer about this all the time, and talk about what do we know about community vital signs? What do we want to measure? What do we think they mean? And what are we going to do about them? Welcome. Thank you.